Board of Health to order on Thursday, November 9th. If you would please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which is stands one nation under God, indivisible, with liberty and justice for all. Thank you. Teresa, would you call the roll, please?
Yes. Commissioner Matthew.
Here.
Commissioner Hoffmaster.
Here.
Commissioner Houts.
Here.
Commissioner Leininger.
Here.
Commissioner Baker. Commissioner Lanius.
Here. We have 5 present, 1 absent. That does constitute a quorum. Approval of the agenda, number 1C. Agenda before us, if there are any additions or deletions. Hearing none, I'll entertain a motion to approve as presented.
I'll support. John support.
We'll all support.
Motion by Commissioner House, support by Commissioner Hoffmaster to approve the agenda. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Minutes of our September 28th, 2023. We have a motion by Commissioner House. Is there support?
Mr. Chairman, I second the.
Support from our other great commissioner from Branch County, Commissioner Matthew. Any discussion on approval of the minutes as they were presented? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. At that time on our agenda where we open the podium to members of the public who would like to address the Board of Health. Would you remind the public, should they decide to speak, that they have 3 minutes to speak for adopted rules? Don?
And Josh is with us as well.
And Josh, yeah. Anybody? All right, moving on. Health Officers Report.
Good morning.
Good morning.
So I start off giving you an update on the CDC infrastructure grant that we have. As I mentioned last month, that's a grant that we can spend over a 4-year period. And our initial plans include interior painting and carpet replacement in our Hillsdale building and upgrading of drinking fountains. I have been working with contractors to obtain bids for these projects and will continue to keep you updated as I get close and we start making some decisions or recommendations for the finance committee. So I do expect that most of these projects will come before the finance committee because of what I expect the amounts will be. There might be a couple of smaller ones, like maybe one drinking water fountain that will have to come your way, but I will keep you guys informed.
Rebecca, I know last time we talked about the elevator upgrades.
Mm-hmm.
Is that already kind of, is that ship sailed or can we include that in this kind of infrastructure grant?
Well, we paid the half down. How did we decide we were paying the other half?
We haven't decided. I'd like to think that we could use this grant.
Okay. Good, that'd be nice, obviously.
Absolutely. Okay, so I'll keep you updated on that. The funding for essential local public health services, we had mentioned that there was an additional $25 million appropriated by the legislature this year to move local health departments closer in line with the 50-50 cost sharing on the state side. The additional revenue that was appropriated to us and is in the amount of $411,468. I have been meeting with the directors and the finance crew to talk about priorities for the use of these funds. Our number one priority that everyone mentioned when we first met was increasing wages for staff at the health department. And we are hoping to continue to move those wages up as we've mentioned a lot lately. The classification and compensation study that we did in 2019 showed that our wages were quite far behind we've been able to move wages up to the recommendation in 2019 as of our last wage increase from last year. But of course, 2019 was 4 years. So we continue to be behind. So that's why that is really important focus. Our staff, our directors do find it increasingly difficult to keep qualified staff because of our wage structure. So that is a really important push, and we're also developing other plans for this fiscal year. The lion's share of the additional funding came into environmental health program, with a little bit for the other ELPH programs. So we are just kind of looking at all of our options, working with our finance team, and we will make some decisions once we have all ducks in a row, so to speak. As far as the local county appropriations, we of course are still waiting for your counties to make final decisions. And I guess that's all I'll say about that at this time. Health insurance benefits are in the packet today for action. Those were reviewed by the Finance Committee, and a recommendation is before you today.
Where are the other two counties on the county share?
Yeah, we discussed it at our budget workshop. We're gonna discuss it again at this next budget workshop that's coming up right before our actual meeting. And then I feel like St. Joseph County is going to pass our portion.
We're tentatively going to look at approving our budget on Tuesday of next week, and then look for final approval on the second meeting of the month. And once that's done, then we'll move forward with the approval for that appropriation request. So
Word branch.
At the table, so I just want to see where else. You could have to like pop to the head that way. Like, what-
All right. An update on the agreement that we have with Hillsdale Hospital regarding the mobile van, and they are pushing back their estimate to start use of that to now March. And very interested still moving forward. It's just that things are taking longer to get that approved as a rural health clinic than they had anticipated. So updates on some of the public health concerns that we've had locally with regards to Three Rivers and the action level exceedance for lead. Filters continue to be available and have had assisted at least one family, and I think more now, with concerns about water quality, such as groundwater, things like that, and getting them in touch with the city of Three Rivers so that the city can do further investigation. Regarding respiratory illnesses, we did send out a letter to school superintendents that was just for information purposes for the schools, provided them with the contact information for all of our clinic supervisors, for Callie, our director, so that if they have questions about anything to do with health and safety, they have phone numbers on who to reach out to. We provided them with links to the resources that the state has available on communicable diseases and best practices. So, anyway, that went out. We do have all 3 formulations of the COVID vaccine. So if you are looking for an updated COVID vaccine, the health department can help you with Moderna, Pfizer, or Novavax. We also have the product for those individuals who are adults and don't have coverage. So if they do not have insurance coverage or they're underinsured, we have the Bridge program. So we can provide that vaccine to really anyone. So we are a good source that way. Regarding flu, we do have regular flu as well as high dose for those that meet the criteria for that. And now is a great time to get your flu shot. I think I might have sent out a note about, I meant to if I didn't, If anybody wanted to get their flu shot while they're here today, we can certainly help you with that. Let us know. All right, and pipeline spill. So you all know about the pipeline spill that happened in Girard Township, I think, here just north of us. They spilled several thousand gallons. Paul's report goes into more detail on this, but we really haven't had to do any response efforts. We are just part of the information group, and I guess I would say that Chris and Joe are part of what's going on there and keeping track. The indispensable supervisor training that you approved is underway and has been positively received so far by the team. Opioid settlement funds, we are working with St. Joseph and Branch County still to get that request approved. And looks like we'll be doing something for St. Joseph County in December now. I need to check back in with Bud. Last time I checked with Administrator Norman, he indicated that he didn't need any additional information. I don't believe there's been any action on it either. And then today, Josh is here to talk about the proposal that we have made and answer any questions that you might have as Board of Health member. For our cold water office, no new projects. We've been in communication, Teresa and I, with county maintenance, providing some of the critical work that really needs to get going on, which includes the restrooms here in this hallway. There's a counter in the clinic that needs to be addressed. And then we have started conversations about the drinking water fountains. In Hillsdale office, as I mentioned already, with the elevator and, working on getting those bids for the interior upgrades. Sturgis, fully using that new space. And Three Rivers, part of our infrastructure upgrades includes replacing the old and outdated water fountain. And I have had a contractor in already to take a look at that and provide me with a report. And that's what I have for you today.
Any questions for the health officer?
Yeah, I do. Thank you.
Commissioner Laney?
The appropriation of $411,000, what kind of restrictions are tied to that?
Well, those are funds that are designated for essential local public health services. So those core functions of food, drinking water, on-site sewage, communicable disease, STIs, hearing and vision. No, was there anything else? I'm missing anything?
You're not at 9 yet. Immunization.
Immunizations.
Infectious
thank you.
disease control, STDs. Hearing, training, vision services, food protection, public water supply, private groundwater supply, and on-site sewer management.
So those are the programs that needs to be spent then.
Anything else, Commissioner?
Yeah, the filters that are available, is there a cost on those?
They are supplied by MDHHS. We have we don't pay for them. The client doesn't pay for them. If they're in that area, but they don't get them, they're not in the area that's designated as well.
Commissioner Matthew?
Thank you, Mr. Chairman. Thank you for your report, Health Officer Burns. That paragraph 2 you have presented before us, what our Commissioner Lanius mentioned, essential local public health service. And the chairman just indicated few of the items, the intent of the legislatures, that 25 million they have, in addition to what already we get, 400,000, 1,100 and 468. So my initial concern would be this: we have already over 4.5 million in the bank from the treasurer's office, and the legislature listen to us. They appropriate to us over 400,000. I personally believe that Chairman indicated, I think he mentioned about the personal health and prevention and so many other things. I think we should consider spending that money, 400,000, for what the legislatures intended for. I do not know all the details, even though I worked at the Health and Human Services lobbying. Number two is, Mr. Chairman, mentioned about that our share of the counties. I do not know how our county is going to address, but I am reluctant when we have money sitting in the bank. Bankers are enjoying that money. I think that money should be utilized for the benefit of our employees. So I pray that, Mr. Chairman, our finance committee really dig into all the details, how much money we have, how much money we are going to spend here before we go into golden escalators and things like that. Thank you so much.
You gotta go to New York for those. Commissioner,
Can Rebecca address that a little bit? So you're saying, so Tom, you're saying there's $4.5 million. I heard you reference $4.5 million.
Yes,
So the $4.5 million, I would assume that's restricted.
So Teresa's gonna help me with those, because she's got a better handle on the different pots than I do. But there is designated balance, there are restrictions on the funds that are sitting there.
Yeah.
Um,
I mean, the majority of that money is the same, this is the same money we've been talking about the last couple of months. The majority of it is restricted. The vast majority of it is Medicaid cost-based reimbursement dollars that can only be spent in immunizations, hearing, vision.
But
Because it
those-
can only be spent in the programs that it was earned in.
but those are local central public health services, right?
They are ELPHS funding. And that's the problem that we have right now, is we just got more money for essential local public health services. And we already have money for essential local public health services. It's the ancillary services that get us in trouble. It's all of the other things that we do here. I can't raise wages for the people that work in ELPHS programs and not raise them everywhere else to spend some of that money. And it makes it additionally more complicated because, you know, a nurse in our clinic, he reports to immunizations and STD, but she also does WIC and she does all of these other programs. Most of our clinic staff have upwards of 5 to 6 programs that they split their time in based on where we need them at that time. So it makes it difficult to, you know, like raise wages to spend these dollars because I can't afford to raise the wages in all the programs. Most of the money that I have right now is ELPHS funding, and it can only be used in those 8 to 10 programs. So it really, we have 40, 50 RUs here, and you know, staff spread their time for all of these different things. So a wage increase, it makes it hard. And we get only, it's like 10% of our local money, you know, this makes up the percentage of our budget. So that local money that we get from the counties is the only money we can spend wherever we want. So it makes it hard. We're juggling the ball and trying to figure out what we can do to increase the wages, spend the money that we have, and, you know, move these local dollars to where we can target them to do the most good.
Which is why I'm not bringing to you a proposal yet to say, you know, how we're spending that 411,000. Because we're still, I mean, we didn't get notified until what, a week and a half ago? It just, yeah. So we just got notification. We're already a month into the fiscal year. You know, it's just, it becomes very difficult to plan and be able to tell you how we're gonna use those. We're still trying to work it out. We do have ideas. Our finance team has been working on those ideas over the last couple of days. And, you know, I think we have a good start to that plan, but that 4.5 million is just, can't just grab it for anything. Unfortunately.
So if I have somebody in Three Rivers that is doing, our Vegas Township that's building a house and they ask Paul to come out, Paul's crew, environmental,
Yeah.
to come out and, to check the, not sewer,
Septic.
septic.
To do a,
Septic.
well, they would, potentially first do just a vacant lot inspection.
For the
see if that-
permit.
Well, to see if the lot is, would perk or, what they would need,
Yeah.
right? Then, they would pull a permit for that, they would, and then if they ended up deciding to build, they would pull a permit for the septic installation and then, Paul's crew is gonna go out and inspect that and make sure that the septic is installed to code.
So although, we don't require the vacant land eval, that's.
It's optional.
Yeah.
But all of that funding, is that local dollars that funds that, or is that the,
So there's fee dollars, so direct fees that we collect for application
From
for
the
those
homeowner.
permits. There is ELPHS funding that comes in there, and those programs are generally supported a little bit with, do you have any of that with you? A little bit of local. And the rules are, we have to spend the fees we collect first. And then we can start to tap our grant.
Yeah, so last year for on-site sewage disposal, that program was funded by state and federal grants. It was also funded by ELPHS money that are others, and we put almost $65,000 worth of local dollars in there.
okay.
And then there were also fees that we charged to them.
So when I'm talking to this with other commissioners in St. Joseph County and with, residents of the county, one of the things that I point to is that, the health department serves that purpose. If you always hear, man, I can't get a permit, or it's taking forever to do this and that and the other thing. And it's like, okay, well, we have to have the employees, the staff, to be able to carry out the duties of the health department. And, it's black and white. You either pay them and entice people to be employees of the health department so that you can have that capacity, or you don't, right? And you suffer the consequences of that. So I guess that's part of my argument at the county. And that's not for you guys, that's just at the county level. It's like, okay, we have to provide these services to our citizens because we hear if we don't, right?
And we've had a heck of a time hiring some of those open jobs. We had a position open in Hillsdale for months. It was a long time before we finally got a person in there. Our non-community position was vacant for quite a while as well. So it's hard to bring, so then you're down staff and everybody's doing more, right? And there can be some longer wait times, to get those demand services, the ones people come in and ask for as they need them, because staff is short. And when, people want to do these projects, they kind of all tend to want to do them at the same time. When it's spring and when the weather's nice, everybody's showing up and wanting to build a new house or, replace their septic system, whatever it might be. So it takes longer sometimes.
I've never met anybody that really wanted to show up to have to replace their septic system.
Yeah, totally understood. Usually your water supply, if your well goes dry, you may not like it either, but you're in there, right?
Yeah.
Yeah.
I guess the question that I would have on the 411 and, or part of the whole 25 million altogether is, was that one-time appropriation?
So we should be able to expect it every year from now on, unless the legislature makes a change, is what we've been told by MDHHS. So this should be, money going forward the same.
So the 25 million was an increase in their
Mhm.
general fund appropriation from the state to,
MDHHS. Mhm.
through the MDHHS budget for, local public health administration.
Some of the money came directly through MDARD and some of it came through Eagle and then MDHHS was, so MDHHS kind of is like the convener. And then they talk with MDARD and Eagle. But some of those funds flew through MDARD and Eagle. as
Because,
well as-
because the on-site sewage disposal, the water quality, those,
Or
you have to
Eagle.
work with Eagle, and the food inspection,
Is
is
MDARD,
MDR.
yes. And those are the programs we got, the lion's share of the funds, the additional funds, were the Eagle and the MDARD. We got a much smaller amount for immunizations, CD, STI.
Mr. Chairman,
Commissioner Matthew?
thank you. Thank you for the information, appreciate it. I wonder, before our next meeting, we can get some input. I know you have met with the departmental directors according to paragraph 2 about the compensation. But I wonder we can have some, not only what is going on now, what we are do additional essential local public health services for next year 24. We have something going on now. What are we going to add with these $400,000? Can we get that, an idea, so we can discuss? And the financial department will know, so where to work, where to put that with the committee.
We have a plan that, our accountant has been, taking a look at. And I think I just heard from Teresa today that our plan, should work. So we're happy to share that, but we weren't ready to do it today. Of course, so.
Okay. We'll look for something coming to the Program Policy and Appeals Committee or in the Finance Committee.
Finance probably, or both. It's
Probably both, I mean, if it's,
Did you report on the awards?
We were recognized at the Michigan Premier Public Health Conference with a Director's Award this year. Always a pleasure to be recognized at the state level. The nomination that was submitted, what they talked about was the work that we've done in our children's special health care program. And bringing services, working with providers to bring services to individuals that lack transportation. So, pretty cool. Thank you.
Congratulations.
congratulations,
Thank you.
Commissioner Matthew.
Thank you. I'm sorry to take it valuable time. The last paragraph, you have indicated Hillsdale Hospital is finding it is taking longer to get approval for the van to be used as a rural health clinic. It's wonderful. However, are we going to use two or we are completely giving to them?
No, they, the agreement we have with Hillsdale Hospital is for 2 days a week out of 5. So, the van would be ours to use the other 3 days.
The only reason, Mr. Chairman, I mentioned is there's 150,000 investment. So we want to make sure all 3 counties
Right.
receive services through your guidance, of course. Thank you very much.
Absolutely.
Any other questions for the health officer at this time? All right, moving on. Medical Director's Report, Dr. Luparello.
Good morning.
Good morning.
My report is in your packet. I guess the highlights from the last month or so is I am also taking the indispensable supervisor class training, which has been greatly appreciated. We're in our kind of second module. A lot of us in the room are taking it, so interesting and lots of good ideas for supervisors and how to create some good teamwork. my class this semester is a capstone project on human papillomavirus vaccine hesitancy. And then I will, after this semester, have only one more class. So spring, I will be taking an elective. I think I'm gonna take emerging diseases or something interesting like that. And then so we kind of flew through, which is nice. I just only saw one latent TB patient in the past month. She was actually delightful and agreeable, but that also means that Heidi is taking some time every week to watch her take her medications. So that's a lot, you know, it's just a lot to do that observed medication. So they're doing some Zoom stuff. Sometimes she comes in, but it's a lot. It takes a lot of time. So, and
On that, Doctor, does that continue to be primarily, refugees from
yes, yes,
Eastern Europe?
yes. I've not seen really any, like, I grew up here, I lived here, cases where all people coming in from other countries. We've had some Haitians, mostly Haitians. This lady did not come in to work at anywhere in particular in the area. She just came, she has some family here. So we see that a lot, like people are already here and then the rest of their family comes. Very interestingly too, we were chatting and her son was supposed to come with her and his visa got denied at the last minute and she came anyway. So she's sort of called her that she left with her family and they're working on that too. So just kind of, they're usually kind of sad stories. Yeah, a little bit unrelatable, you know, that life must be so much better here that you're willing to make all those sacrifices. So when we're all complaining about what we have here. So.
Appreciate what we have, right?
Yeah. And then I'm going to an emergency preparedness class on Monday with Chris and lots of other individuals in the room as well, so that we can work on that. Oh, and I wanted to add a thank you for letting me leave a little bit early the last meeting. We made it to my son's parents' weekend. My daughter actually drove down from Maine and met us as well. And I could tell a story that it was raining. It rained a lot that weekend. And so I was insisting that he get a pumpkin for his room. And he kept saying no. And I talked him into just one of those little like 50-cent mini pumpkins. And so I got back and the next day he called and thanked me for the demerits that he got because he had something organic in his room that wasn't allowed. So it was a lovely weekend. Yeah. I said, how many demerits are you allowed? He said, I don't know. These are my first ones. Thank you.
Because
here's this mini, like you could have hidden it or so I don't understand that, but another military rule, nothing organic in your room, I guess, despite the fact that I saw food in people's rooms, bananas in people's rooms, plants in people's rooms.
That's
little
not
pumpkins.
organic.
Kids are not permissible.
Pop-Tarts.
So, so educationally for this month, I decided to kind of revisit the respiratory syncytial virus issue. I think we probably did it about a year ago. And at that time, we talked about it because this is kind of the fall season for RSV, which is very common. So you'll start to hear some cases. But at that time, there was nothing to offer other than supportive care. And very recently, there are some immunizations and some antibody treatments. So if you hear people talking about RSV, there are some things that we could do. So again, it for most of us would be like getting the common cold. We might be sick for a couple of weeks. We might not even know what we have, and then we get better. But for premature infants, babies with any heart, lung problems, adults with heart, lung issues, and any immunocompromised, it can be pretty significant. And if we remember, you can get it, someone sneezing, coughing next to you, those respiratory droplets get in your nose or your mouth, and also on hard surfaces. So very interestingly, it can linger on hard surfaces for quite some time. It can linger on softer surfaces like people's hands for quite some time too. And we worry about bronchiolitis, inflammation of the lower respiratory tract, and pneumonia. That's often the reason that people are hospitalized or pass on from respiratory syncytial virus. So younger than 5, the CDC reported 58,000 to 80,000 hospitalizations in the US last year, with 100 to 300 deaths. So, significant again to watch. For the adults were kind of interesting. There were almost the same amount of hospitalizations, about 60,000 to 100,000, but there were between 6,000 and 10,000 deaths in 65-year-olds and older from RSV. So something that we used to kind of see as a category. What do you do about that, right? They're a bit older, they're immunocompromised. So recently approved in May of 23, there have been some vaccines for respiratory syncytial virus for individuals over 60. So it's warranted that if you're over 60, you chat with your primary care doctor to see if you have any risk factors that might make you amenable to that vaccine. Again, the vaccine does not prevent RSV, but it might help with the respiratory problems that you've got from RSV. And then they're also recommending that same vaccine for pregnant women between 32 and 36 weeks gestation. So that gives some immunity to the baby when they're born. And then there are some very new newborn vaccinations as well. So newborns, especially born in respiratory syncytial virus season, will get an antibody that kind of helps them to fight off the respiratory issues from RSV. So just thought that was interesting that we talked about it last year and there really weren't any vaccines. And then this year, just last spring and summer, there have been so many new innovations for RSV. So I'm glad that people are paying attention to things that, are potentially deadly in certain populations. I think that was all I had on RSV.
Question three, Commissioner Matthews.
Thank you, Mr. Chairman. I understand Dr. Luperlo is continuing her fire alarm education. I wonder if she would volunteer to share that information with our federal legislatures. That would be good.
That
Yeah.
has been wonderful. It's taking me a long time. There's a lot of information.
Okay,
Yes, I would be happy to.
was that an elective?
No, that is something, I'm sure we found that, Rebecca, maybe. It's a kind of a course through University of Michigan. We were hoping to kind of present it to the local physicians and providers if they could get some CME credit, but it's pretty long. It's lengthy. I don't know how many people are gonna take the time. And it's not anti-gun, but it is more safety driven and talks about the issues when we're not safe. So yes, I'd be happy to.
Especially the federal legislatures from New York.
Mhm.
All right. Any other questions for Dr. Luperlo? Thank you, Doctor. All right, we will move ahead into department reports, and some of our department heads are not here today because they are participating in the indispensable supervisor training.
It's actually, ICS 300, so it's emergency preparedness
Okay,
training.
emergency pre- they're out.
They're training anyway.
Chris
It's
Dewey's
great.
got them out on training, so Becky is going to do the health education and promotion, and then she will probably move right on into personal health and disease prevention, so.
And so we're gonna kind of go pretty quickly through these, but I wanted to point out that in health education, their primary topics for September and October included health and aging, food safety, safe sleep, protect your groundwater day, septic smart week, which Paul actually went and did some radio time on, Hispanic Heritage Month, breast cancer awareness, children's health, flu vaccinations and flu season, and fire prevention week. So lots of information shared out on social media about those topics. Of course, the fairs were fairly recently in St. Joseph and in Hillsdale, so those kind of wrapped up our summer getting out activities, although certainly there are still events where we participate for health education that occur in the winter. Community health worker wise, you can see that in the month of or the report for August, and they brought on 7 news and have had 60 total to date. So that program, even though we only have one worker in it, is continuing to make a difference, with the individuals that are served. And our social media, if you look at page 12, we are up in a couple of areas there with our reach, which is always nice to see. So moving on to Kelly's report. He also talks about respiratory diseases. And so we're not going to go back through that again. Immunization wise, the offices now have those COVID-19 vaccines, as I mentioned. So we are able to provide those vaccinations. We don't currently carry the RSV products, but we are looking into doing so. So hopefully by next month, we'll be able to tell you that we have brought some of those vaccines in-house. For WIC, she talks about changes coming next year to Project Fresh, and she'll keep you posted. And then she provides information on caseload, which has increased since last year around this time. And the Children's Special Health Care, which does also supervision in our hearing and vision and lead programs. There is a new lead bill that passed in the state that is going to mandate lead testing for children at 12 and 24 months of age. And that law was signed and will become effective January 1st. I actually attended a meeting yesterday with the state about how they are getting the word out to providers and the updated materials that the state has on lead, all of the work that's being done to be ready to go for the January 1st start date. Here, that additional testing may result in more cases being identified and will make our nurses that do case management, perhaps a little bit busy, which is a little bit concerning. And we will just need to pay attention to how that goes. We do have another nurse that we're training currently to be able to do the lead nurse case management, in addition to the that's been doing it for a very long time. So it looks like that's what Callie had for you.
What was the age group for that testing again?
12 and 24 months.
I thought it required a mandatory test between the ages of 12 and 24 months of age, not at each, but it was between those ages. Somewhere in that time frame, they must supposed to have a.
You are probably right.
I
And then
didn't
if
think it was gonna
they,
mandate two tests, so it was just
yeah,
between 12 and 24 months required.
Not tested.
Yeah.
Later.
yeah,
But
and if
when
they
it's-
miss the 12 and 24, then they want them to be picked up. And then, but there's also an increase, an addition at 4 years. There's a 4-year testing.
Right.
Is the state paying for that test?
I don't know, there was lots of debate about that. Physicians were kind of like, you know, please just leave it to our discretion, right? I mean, some people are living in, never with any lead exposure and the kids are fine, you know, seemingly fine. So, and then it got pushed right through. People are worried about their local health departments not having enough staff and yeah, pushed right through despite
We're certainly concerned about, a lot of time being spent in lead case management.
Is the state gonna provide us more money to do that?
I haven't seen any of that yet.
An unfunded.
An unfunded mandate. Huh,
Weird.
imagine that.
Happened.
We will continue to keep an eye on it and we'll keep you informed, so. It is a big change.
Well, and like I said, or even, okay, well, your local doctor has to do it. Well, so now that's a test that you've got to put on your health insurance. And well, that's a diagnostic test. That's not preventative services, so it's not covered as preventative services. Now it's subject to deductibles and co-pays.
I did hear yesterday in that meeting that there will be a parent opt-out. So parents will have the option to opt out of the testing. And what I immediately thought of was, what if they opt out, but then, they shouldn't have, right? Does the parent end up in trouble? But yeah,
How do they go about opting out?
there's a paper form apparently that they'll need to complete, and I don't know that they've worked out exactly how that's gonna work yet. But, there is an opt-out option. Kelly did give you, this little diagram on immunization, so it's pretty thorough. It does a nice job of all of the respiratory, vaccines there, so if you wanna take a look at it.
Yeah, to me, the thing that stood out from her personal health and disease prevention report is the increase year over year in chlamydia cases in the Tri-County area. Went from 348 to 520.
There's a real problem with, STIs.
Usually have one county that's less.
Well, they are, but,
Cassopolis, Casco.
if you look at the numbers, Commissioner, both of our counties saw an increase in that this last year too.
Thank you.
Not quite as bad as what the county to the west is, but
How can you leave?
well, they do have the largest population, so.
Yes.
All right, moving on. We have environmental health, and Joe is here today. And Joe, I'm sorry, your last name is
Frazier.
Frazier.
Good morning.
Morning, Joe Frazier.
Joe
Frazier.
Yeah, I was popular in football. Paul kind of came up with a quick little report for you here. The first part of it is a food service. So what I've been engaging in a lot of my time recently here is training up one of our new staff members over in Hillsdale County, Olivia Jacobs. She's our 50-50 person. So she'll be doing 50% wells and septics and 50% food. The state requires that the food training's much more stringent and official than well and septics. I have to go out as a standardized trainer. So FDA standardizes MDARD, MDARD standardizes them, so then we go out and train our staff. So I have to do 25 joint inspections with Olivia. Then Olivia will do 25 inspections on her own, which she'll report those back to me. I'll review them, make sure that the violations are cited correctly, that they're written properly. And then once those 25 are done and she's feeling good and confident, we want to set her up for success. We go out and do another 5, which are graded. And those inspections, she has to meet a criteria of 80% based on our findings. So I do the inspection at the same time she does. We come together and make sure that they're pretty equal. Once that it's all said and done, officially she is standardized to go out and do inspections. So she is, I think we're at 22, 23 of our first 25. So we're really close. We're getting there. And she's doing a really nice job. So we're excited to have Olivia on our staff. Wells and septics, we have been given some money to have 2 type 2 coordinators in our agency. We have Kyle Moore, which he's been with us for a while, and Kyle does a great job. I think he's destined for great things in public health. And then we just hired Kaylee Bonner. She's going to be starting the 20th here in Branch County. She'll be stationed here and working and covering Branch and Hillsdale County, doing our type 2 water systems. So that training is going to be pretty extensive as well. The state of Michigan has come out with 5 new programs, computer programs, to run that one type 2 program. So there's a lot of training that's going to be involved in that. And we're lucky that Eagle staff really kind of lead the way on it. So we're looking forward to that. And I think she's going to do a great job. Paul did report here that we did offer for our clerk position here in Coldwater. Unfortunately, that person didn't return our phone calls. So we are back to square one on trying to find a clerk. Myself and some other Coldwater staff been trying to man the front the best we can, but we're hopeful that we have another interview this coming Monday that'll go well. And then the very last one is a little bit of a quick overview on the BP spill up in Girard Township. Chris was working in that a ton. I actually got on site. They were doing some neat things. Like they had air monitors placed all over up there, and they were all linked cell wise, so that any second they could look and see what the air was like at any given point, and really help the residents up there make sure that they were safe. They're doing the best they could to get the contaminated soil up and away, and get that taken care of. So MDARD, or not, excuse me, Eagle was really taking the lead on that, and we were just kind of asked to go up and take a look. In the future, as Paul stated here, there is a possibility that we will get involved for water sampling, but we don't know where that's at right this point. That's going to be down the line. So, but we're still in touch with them and talking. So that's what we've got for the report. I appreciate your time.
Any questions for Mr. Frazier? How is the staff liking the new program, Phil?
We're getting used to it. At first it's like anything new, right? You do it and you're like, wow, this
It's different.
is different. You're like, oh man. But now, in a way, I'm blessed that I've been able to work the front with losing our clerk. I feel like I have a much better understanding of how it works now and how to get a receipt and how to do it. I have a better idea of the inner workings of it. It's really coming along. From a food standpoint, I think our reports are much better, much more concise, clear. It presents the information to the operator in a very concise way. So that way, if there are infractions or issues that we need to deal with, they can see that and it's right in front of them. They don't have to guess and go, well, what were you talking about here? Part of our job is to work with these operators and not to make it more difficult, but to help them out. So this is going well, I think. I enjoy it.
Any other questions for Joe? All right, we will move on to Ms. Laura, the Area Agency on Aging report.
Good morning.
Good morning.
I've had so much to say as to reduce the font size in my report, so I hope it's not too small. I'm definitely wearing my glasses this morning. Lots to share. We had another record year in the elder abuse victim assistance program, serving 62 individuals last year. And the team has been, again, extremely busy coordinating and bringing new topics and discussion to the county's interdisciplinary teams. We also included this year, with the victim's permission, the case scenario that was submitted. I think it demonstrated exactly what victim assistance is, what it can do to support somebody through a very difficult time. And if it pulls at your heartstrings, that's what it's supposed to do. It's a pretty heavy case, and it is going through the judicial system right now. So we've been extremely busy, along with our health promotion friends across the hall in outreach events. Finished up the fair and did a lot of neat stuff toward the end of the fiscal year and into the new. The Project Connect event in St. Joseph County was extremely busy, all ages, but very good, strong conversations, and we're still working with some of those individuals that came to us to talk about community supports, so that's good. It's a real busy time of the year in terms of some of our reach, because we try to talk to people about social isolation over the holidays and when folks don't have family and friends to celebrate with. That's a really daunting time of year for some people. So we like to be a resource, and we'll be promoting, that we're here. We can be a friendly visit and talk with them. National Family Caregiver Month is this month. It was a huge theme at our annual conference this week in Lansing. Caregivers provide billions of dollars of care in Michigan annually, and we need to make sure that those individuals understand what's available to them to support them in their role. In items of other items of note under number 3 there, it's kind of a mishmash. I talk a little bit about provider updates. Our Commission on Aging here in Branch County did announce their decision to end the restaurant voucher program as of the end of this calendar year. They've worked with and collaborated with the Union City Senior Center and wanting to offer more meals at a donation base at their new senior center there in Union City. So they and the village have reached an agreement. And so we're in the process now of getting that site opened with the state of Michigan and according to the Bureau standards. Joe was generous enough with his busy schedule in this busy time of year with being down staff. Also met with the food director and their executive director to go over and assure that the food licensing and the standards are being met from the food side of the world as well, because the Union City Senior Center is not affiliated with the Branch County Commission on Aging. So the food license and those types of aspects of the program were discussed with food. So we're grateful to have that consultation so quick and close within our building and in our community. So it's a great working relationship.
So the bill will be prepared, weird and shipped up.
The milestone contract that they utilize here in Branch County will drop to Coldwater's site first, and then on their way back out of town after they've actually been in their own containers. They have those plug-in hot boxes. So the temps will be maintained that way, and they'll be teaching the staff, which are covered in their agreement, to assure that the training and the standard operating procedures, SOPs as Joe calls them, are adhered to by those staff at the Union City Senior Center. So, and I know Mike, their food director here, will be on site frequently to make sure that things are going well, and it'll be the same menu as the folks in Coldwater enjoy, and they're really looking forward to it because it will increase the number of times that somebody can eat, have a hot new meal. Right now, the restaurant vouchers only allow for 2 donation-based tickets per month. So now this will be 3 options each week. So it will be a nice opportunity for folks. Our advisory committee is still reviewing standards. They haven't been officially adopted quite yet. So once that happens, we'll take a look and provide the Program Policy and Appeals Committee an opportunity to review new bylaws for the committee. They're, as we previously discussed, one of the biggest things is the Open Meetings Act standard was removed. So we want to bring those bylaws back to through the process for revision as well. I did include the transmittal letter in my packet, which covers the new way that the state is sort of divvying up the pie for the aging traditional Older Americans Act and Older Michiganians Act funds. They've added additional weighted factors for individuals living here according to the census that are 85 and greater and who are have limited language or limited English speaking individuals. So those factors will affect us because we will likely get a percentage point or 2 less in that piece of pie. We haven't seen those the changes quite yet, but the Bureau's still issuing those.
Sometimes I am LEP as well, Laura, so add me to that list, I guess, to help increase your numbers.
If you've indicated that on your census document, the Hillsdale County figures will be reflected there. Let's see, the continuing resolution. Yeah, so the federal government is still next Friday to get a budget into place. They may do another continuing resolution, which might give us a few more months of funding. Right now, we're operating on 2 months of funding. Which is really uncomfortable. It's really difficult, and it makes Teresa get a little under the collar. We did send out guidance to our providers to say, please stick to 1/12. We don't have $100 sitting around to be able to pay you. And then also talked about our contingency planning. If a budget agreement is not reached, that could shut down the government, and we would all have to report our time and expenses different for that period of time, which causes a lot of complications and could limit services to older adults, and we don't want that to happen. So, so again, we've been in discussion with our providers to try to mitigate that, and nobody really had any questions, so I think they're all feeling okay. We're very blessed. Have local millage funds in both counties, so those are the dollars and the resources that are kept during a time like that. But we also have some providers that don't have millage funds, so they could be affected. That's about all I have for you today.
Any questions for Laura? Mr. Matthews?
Thank you, Mr. Chairman. I have one question. Director Sutter, thank you for your report. The page 33 to 38. You have a very good detailed report. However, wondering that includes the elder daycare as well as the nursing home. And number two is, do you have a separate numbers for elder care or nursing home incidents like this, please? Page 33 to 38.
So this is the victim assistance program, and the report is separated by county. So the type of interactions and the type of victimizations are separated by county. And then on page 37, it's the combined total. So some folks that we work with do live in a formal care setting, like a nursing home or an adult foster care home, and that's noted in terms of their housing situation in the reports. I guess I might have misunderstood you. Does that answer your question, Commissioner?
Almost. Yeah, my question was, do we have I know many homes, according to your report here, there are bullying, domestic family violence, and so forth. But I wonder any report from the elder daycare centers or nursing homes within our 3 counties. I do know that the state provides some information, but I wonder if you have a bit.
Those numbers would be included in the report. If the victim lived at a nursing home in one of our 2 counties, Branch County has 2 long-term care facilities, as well as about 30 adult foster care homes, that would be included in this report.
Thank you. Thank you.
You know, I appreciate the work that you guys do in that elder abuse stuff. And Laura, you said that last year you had a record year of number of people that you were able to help. Unfortunately, I look at that as a bad situation. You know, I serve on the Walleye Services used to be Region 2, and you know, the goal for a number of people able to serve in that has always increased. And it's like, why are we should want to see that number decrease, because not that we don't want to help people, but we just don't want them put into a situation like that is reported on page 39 of our packet. So
It's quite interesting. It's a silent crime. You know, the statewide coalition, the Elder Justice Coalition, for decades now has called this the biggest silent crime in the state of Michigan. Yet anybody can be a victim, no matter what age they are. Just got an Attorney General notice today that said Gen Z individuals, so younger folks, are being scammed out of money left and right. They're one of the biggest victimized group of people now. So it's not just for adults. It's not just people, vulnerable adults that rely on other people for their care. These scammers are getting so good. Tech savvy Gen Zers are getting scammed.
well, they're so used to just clicking.
They're clicking links and it's taking them to places that they're not looking into, and then obligating themselves. Oh yeah, here's my routing number, or oh, here's my Venmo you money, or however. It's really concerning. So
Tell them that when somebody has something to Venmo money, put it in a negative figure.
Okay.
and then hit submit. So apparently it'll work that once the other end approves it, it actually takes it out of their account.
Well, the nice thing about the work that we do at the county levels with these interdisciplinary teams is the discussion that occurs, even if it's a sidebar conversation before the meeting or after the meeting, it gets people thinking about it, and it's for each of their disciplines, whether they're a mental health professional or in the courts or out in the field as an adult services staff. We're all talking, so we're all kind of alerted to some of the stuff that's going on, and that's exactly what needs to keep happening. So it's good.
I apologize if I don't answer anybody's emails. I always think everybody's a scammer, so
We'll
I
know
don't
when-
click on any links. I don't reply to any emails.
Safe way to be.
Yeah.
Boy, it's not working. As I said, you got that. That ain't working.
So, so paranoid.
All right. Well, thank you, Ms. Sutter. We have number 5E, emergency preparedness, and that would be Ms. Dewey. Chris.
Good morning.
Good morning.
I'm just gonna cover a few highlights from the report that you have in your packet. We will be meeting with the Michigan, Ohio Emergency Preparedness Coordinator Group in Hillsdale County on next Friday, the 17th at 10 a.m. That will actually be held in the Commissioner's Boardroom. I have been made aware that Lucas County, Wood County, Lenawee County, all will be in person in attendance, and then I have not received confirmations, but the remainder will be part of the hybrid meeting. So this group of folks include epidemiology and the others that do my role, and we talk about what we're seeing, what's going on, and do some planning as a border community, because Ohio and Michigan have different rules, but there's a lot of things that we can kind of work on together, and situational awareness is probably the best tool that we get from that border communication. We also started a Indiana-Ohio border group, and that group just met this past week, and we are talking about working together on some type of a planning project. There was a lot of conversation about how are we planning for populations that are immigrating to this community that may be English language limited, or we're seeing a lot of folks coming that have no in-community ties, and so they don't come to, they have no family to stay with, they have no resources, they have no job, they have no green card. And so we had some discussion about how we are managing that process and what types of resources we're seeing develop in communities. So it's been a very good group of emergency preparedness talking. The Ohio Indiana group, and I'm pleased to also say that we have our tribal partner in that group. And the tribal partner is out in Cass County. It's the Potawatomi Pokagon Band. Their emergency preparedness coordinator has joined us, and so I'm very pleased to have that group of folks with us in that meeting.
When is that, wait, Chris, you said third?
The 17th, it's Friday, and it begins at 10 a.m. in the Commissioner's Boardroom. You're welcome to attend. If you want to hear about what all my counterparts are doing at the bottom of the state and the top of Ohio.
How long will that last?
It's scheduled to go an hour and a half, but if you just would like to make the appearance, and we can introduce you and you can welcome them, and when you get.
You said Wood County, but it would be Williams, Lucas.
So it's Williams, Lucas, and Fulton. Wood County participates just because the metropolitan area, they sort of get into that Toledo space. So they're there kind of as an observer role, which more the merrier, but the focus group is Lucas, Fulton, and Williams counties.
Who from Michigan is there besides us?
Monroe and Lenawee and us. And then the Indiana group is Branch, St. Joseph, Cass, Berrien, LaPorte County, Indiana, LaGrange County, Indiana, Steuben County, Indiana, St. Joseph County, Indiana, which makes for a very interesting conversation back and forth across the border, since we both have a St. Joe County right next to each other. So we have all of the counties that border Michigan from Indiana, and then all of us in Michigan.
So all three counties technically, I mean, you're there
all three
representing
counties.
all three counties
Yeah,
within our agency.
After being part of the Indiana Ohio group, I thought this is kind of silly that we don't have an Indiana Michigan group. So I reached out to all of the EPCs and said, hey, let's do this. And I have been very pleased that they have all responded and they've been very positive. And November was our second meeting as a group. So it's very exciting to actually have that cross communication, and it has brought benefit. We received a phone call from a resident in Hillsdale County. And as you may be aware, in Camden Township, Little Long Lake is shared by 2 states. It's shared with Steuben County and Hillsdale County. We got a report from Eagle that there could potentially be a harmful algal bloom. I reached out to my counterpart in Steuben County and said, we just got a report from Michigan Eagle that there could be a bloom in this lake. It's partly your lake. They have the outlet. So the water, if it was a bloom, the water was headed to Indiana. They actually sent their team to go out and check the water samples. And they were actually on site before Eagle got on site to check. So we knew that there was some bloom activity in that lake. It hadn't reached the level that required a no contact advisory to be issued. But we've been able to communicate back and forth, and apparently there were a couple other incidences since that incident. And so it's just nice that we can pick up the phone and communicate back and forth and make our friends to the south aware of what's going on. So.
Well, like Thomas Whitaker, the county's emergency management director, will he be there? Are they invited as well?
Emergency management is not there. This is strictly local public health.
If I could, I just want to point out that it's because Chris made it happen that we have an Indiana Michigan. I just want to be clear. She made it. We have good.
We do. We have lots of good things happening here. So as you see, there's the training and exercises. Just giving you kind of an overview of what's been happening. Upcoming on December 5th, there will be a Region 5 Medical Response Coalition tabletop exercise that will be focused on a chemical response with a medical surge to the hospitals within the region. The health department will participate as part of that tabletop, although it is designed more as the hospital surge. So we will be a supporting role in that tabletop. Again, that'll occur December 5th. Also under training and exercises, I'm developing our 3-year training plan for the agency. That will be due to the state by the end of this fiscal period. We held our first integrated preparedness planning workshop with Region 1 on the 30th of October. It was well attended. The Hillsdale County Emergency Manager and the Emergency Coordinator from Hillsdale Hospital personally showed up in attendance at that meeting in Lansing. And so the 3 of us had the opportunity to talk, and they were able to share with the entire region information about what their plans are. They both kind of just gained some new information and insight, and it will open some additional conversation for us with those folks.
So to clarify what Region 1 is.
So Region 1 is Hillsdale County, Lenawee County, and then it goes up Ingham, Shiawassee, Berry or Eaton, because they're like us. Well, one of the counties in Region 5's, one's in Region 1, but I can't remember. I think it's Eaton.
Eaton is.
Eaton would be
Eaton's in
to the east, Berry's to the west.
Yeah, so Eaton is in there. Ingham, Livingston, Shiawassee, Eaton, us, Lenawee.
Jackson.
Yeah, Jackson County.
Gotta
Sorry,
get
thank
Jack,
you.
can't get,
Can't get there without Jackson, right? Yeah, so we had 25 in attendance, and we had representatives from Michigan Department of Health and Human Services, the Emergency Preparedness Group. We had fire, EMS, hospitals, local public health. The Region 1 Healthcare Coalition was represented as well. So we had a really great conversation. It was a well-attended meeting. Community preparedness. We've been trying to focus some efforts at making sure that our communities are prepared because individual preparedness is the foundation to community response and recovery and preparedness. So I have done several presentations. Upcoming, I'm going to be providing a presentation to the St. Joseph County Human Services Commission. That'll be Tuesday, November 14th at 8 a.m. is the meeting time. And then I will be presenting to the Branch County Community Network, and that is scheduled for December 20th at 10 a.m. in this office. The presentation will be on the OPEN program, which is a FEMA-based program on emergency operations for non-governmental entities. So it really is talking to the human services organizations that will be supporting recovery efforts, and the presentation is on steps they can take to begin to build a plan to ensure continuity of operations, because we need them to open as quickly as possible during an emergency situation, because our communities may need to rely on them for services. Emergency operations coordination, we will be hosting Region 5's ICS 300 and 400 fall courses. The 300 course will take place January 17th through the 19th, and as of yesterday, there were only 5 open seats left in that course. That course was scheduled to seat 25. And then in February, the 28th and 29th, we will host the ICS 400 course, and currently there are 19 seats available. That course is open to anyone within Region 5, and it is also open statewide. So I have shared it with our partners in Hillsdale County to offer them the opportunity to have a seat at either one of those trainings.
So just to compare, Region 5 is.
Region 5 is Branch, St. Joe, Cass, Van Buren, Berrien, Kalamazoo, Calhoun,
Barry, you didn't say.
Allegan, Berry. I hadn't got that far east. Just trying to go around. So basically up to Kalamazoo County, over to the lake down. So it's an 8-county.
Well, but you're burying in, you said Berrien and Allegan, so they're north of Kalamazoo.
Oh, sorry. Yes, Berrien is directly
Or not.
east of it.
It's,
It's
I'm
Allegan.
sorry, Berrien, Allegan counties are,
Allegan is.
I'm just
Um,
ashamed at how many counties I don't know in Michigan. St. Joe, Branch, Hillsdale, Cass, Cass, that's all.
come on, man.
You need to travel more.
I know, right? Still terrible.
So the emergency public information and warning. We are participating in a crisis and emergency risk communications course that is on Monday. That will be held at the Van Buren ISD office. There will be 4 from this agency in attendance. The purpose of that course is for us to begin designing some templated messaging in the event of an emergency that we kind of have a go-to that we can do a plug and play so that we can rapidly communicate with the community. It's a very good course. I'm looking forward to it. And then after we finish that course, we'll begin working on our agency communications plans for emergency communications. As mentioned previously, I've been working on the responses to the lead level action exceedance in 3 Rivers, and we're coordinating very well with the city. The Director of Public Works and I communicate pretty much at least once a month, a lot of times 2 and 3 times a month. And as mentioned, the BP pipeline incident. I'm very pleased with the relationship and the welcome that I've received from the emergency managers in all 3 counties. Our working relationship has been very good. When the BP incident occurred, I received a notification from the emergency manager at almost midnight, which I was very pleased with because they were still hot in the middle of trying to just get the fuel shut off. So we are working with all of their local emergency planning boards. I also sit on all of their medical control authority boards as representative to public health. One item that is not on my report that I just was able to get some additional information on today is that I have submitted a special funding request for funds that were made available through the Department of Emergency Preparedness and Response through MDHHS. That funding request was to replace the AEDs in all of our offices as the age of the office mount ones are 13 years. They are actually to be replaced at 10. So I've requested special funding to replace those units. Additionally, I requested funding to bring a program to the agency called Stop the Bleed. You may be familiar with it. It's many county partners throughout the district have people that do Stop the Bleed training. This would allow us to support them in their training and provide some additional resources. I requested materials for 100 persons in each county to be trained for a total of 300 individuals to receive stop complete training. So if we receive that funding, I will work with the emergency managers and the LEPCs and MCAs to identify opportunities for us to get that training to the community.
Do you guys all know what LEPC is?
Limited English proficiency,
Yeah, so the LEPC is the Local Emergency Planning Commission.
You're close.
Which in Hillsdale County could use some active representation from the Board of Commissioners.
Wow, it's a shot.
No, there you go, Commissioner, you're the Human Services Committee.
So, the LEPC in Hillsdale County meets once a quarter. I believe our next meeting will be in January. And that LEPC is just really starting to get pulled together. They're still writing bylaws, trying to get participation from folks. So, Mr. Whitaker is doing a fabulous job over there. He and I have worked on several different projects, just trying to get prepared.
Would send me an email.
Absolutely. I would love to do that. We'd love to have your representation. As I said, we're trying to build.
I'll deal with my people and we'll schedule.
Thank you. I appreciate
Bigger
it.
people get a hold of her.
On a side note, Mr. Whitaker presented to the Michigan Township Association Hillsdale County chapter meeting on November 1st, and he did a fabulous job. There were 8 townships, and the conversation came up because of the event here in Branch County with the pipeline. We were trying to Mr. Whitaker was talking to the township representatives about a township government's role in a response. Even though they're not the lead agency, there are still supporting things that they can do that I was able to share with them from the experience here in Branch County. So that's all I have for my report.
Okay, any questions for Tripp? Thank you.
Thank you.
Moving forward, item 6A, approval of payments. We have for us the payment for the month of September 2023.
Make a motion, we approve payments as presented.
Before you do
Motion by Mr. Hoffmaster, support by Mr. House to approve the payments as presented. Any questions on any of those? I do have one.
I have a couple of things I was gonna point out. So on this, first and foremost, I would like to thank Chris Dewey for taking the geography quiz, so I didn't have to.
Yes.
Because her memory on that is way better than mine is. But getting onto the numbers and the stuff that you're gonna see in here, there are a few things that are a little bit unusual. You have Effect TV for a little over 4,000. That was medical marijuana advertising that we did. So that was the medical marijuana grant. And then your Hedgerow software, 26,500. That was the second installment or the last installment of the Hedgerow software for EH. Down under Maple Crest LLC, you'll see one that's a little over 10,000. That includes the $10,000 that we were allowed to reimburse the landlord for the upgrades to the facility that they made. And then on the following page, our Johnson Builders, that's the 35,000 there, completes the payments for the upgrade to the Three Rivers exterior.
The question that I had is, what was the amount we were able to contribute extra to our MERS account?
Yeah, that payment was actually just made, and it's
Okay,
for
so
September, but we did contribute the full 75,000.
I was looking for it on the September payment, so I didn't see an extra payment. So
Yeah, it takes us a while to get the month closed. We actually just finished, Renee largely finished the closure of the month last week. And we're now just going through the process of reviewing everything. I reviewed all the journal entries yesterday, but we really weren't sure what that dollar amount was until way past when September was up.
any other questions on the bills as presented? Hearing none, all those in favor of approving the, I'm sorry, Commissioner.
Thank you, Mr. Chairman. Page 44. The line 6 from the base, 17,371. Merck Sharp Dome LLC.
That would be for vaccine, purchase of vaccine for our clinics.
Thank you, thank you. I thought it was some attorney fees or something.
No. Merck Pharmaceutical. All right, seeing no other questions, all those in favor of approving the payments as presented, say aye.
Aye.
All those opposed, motion carried. Moving ahead to the financial statements for the month end as of September 30th, and I do note that Teresa has on here that this is a preliminary financial statement, so because it was the close of the year as well, so there may be some journal entries that get done yet. So Teresa, do you have anything you want to say right now before we?
Yeah, so it is a preliminary statement, but it's important to point out that the due from state on your balance sheet is $550,000. That's money that was sent to us that we did not spend. That's largely the COVID grants. We have to send that money back. So that will be going back. They generally don't take that back until January or February. So it's going to sit there on the books, but it does have to definitely go back. And then the other thing, I mean, you don't generally see a negative on a balance sheet, which is why I point these out. Your unavailable revenue. So that's revenue that was earned in September, but money that didn't come in until October. So that's why you see that there. And then we did end the year, or we're not finalized yet, but we believe we ended the year at 15.73% under budget. There were a few programs that went under spent, and we did reallocate some of that money to MERS, which you'll see that payment. If you look at page 50, the programs that are showing over, you will see that we did send that additional $75,000 to the MERS underfunded pension plan. So that is why that one is showing so far over. That was local dollars that went unspent in some of the programs. And then 724, which is your PFAS, and that one, there was an increase in activity. The state is paying for that. So the expenses were over, but so was the revenue. Didn't cost us anything additional. The 605 was over because we didn't have the full cost of the Hedgerow software when we did the budget amendment. And then RU 345, that is not really over because it has to be looked at with RU 112 too. And administration did come in as over as well, but that was more revenue. It has to stay in that before it gets spread out to the programs, because 10 is the one that is indirect. So because there's additional revenue in there, we have to keep additional expenses in there. So that is that's where we are with that. I would be happy to answer any questions with what we have here.
Well, I guess first, we have a motion to approve the month-end financials as presented. So moved. A motion by Commissioner Hoffman, support by Commissioner House to approve the financials for the month end of September 30th, 2023 is presented. Any question? Couple of things that just came up there. And back when we were talking about the increase in the fund balance over the last few years, you indicated that several years ago the agency board passed a motion that they would set a minimum restricted fund balance. Do you remember what that percentage is?
It was 2 months of operating expense, which equals out to somewhere in the neighborhood of 17%.
Okay. And then the other thing you mentioned that a lot of those funds that we have sitting in fund balance that are restricted are for ELPHF, local essential public health services. And a lot of that you said came from Medicaid cost reimbursement. And in past years, you had indicated that many of those large extra contributions to the pension fund were because of back payments in Medicaid cost-based reimbursement. Why don't we take some of that fund balance and contribute that to our pension fund to help buy down that future pension obligation in the future, as opposed to keeping it in fund balance.
I would love to do that, but here's the caveat. So the money that we were able to spend, that we received from cost-based reimbursement, that we were able to send to the MERS underfunded pension, that money was paid to us after the close of the fiscal year in which it was earned. So the way this works is we get quarterly payments. And so for this year, we get quarterly payments. We get so much. And they base what our quarterly payment is going to be on what our last payment that's been authenticated and gone through their whole system. So we'll get this year what we earned last year. Okay, so we can only spend any money that came in the fiscal year that it was earned. It's restricted. If it came in after, it's considered a repayment of general fund money that we spent. And I could send that money because it was money from 16, 17, 17, 18. We never received it until 19. So I could send those two payments in full, basically, which is what we did, because it was a repayment. The money that came in 19, even though the money came in, and this was the biggest part of the problem, the money came in 19, but it came in like August of 19, for 19. So a big chunk of that, we couldn't spend it because we didn't even know we were going to get it then. But it's restricted because it came in the year that it was supposed to be. So there is some question right now that Renee is going to be investigating here. As soon as
I
it gets,
have a simple accounting fix for you in that regard then. Just delay submitting your request for that reimbursement till after the fiscal year.
yeah, well, we can't. We have requirements. They're due in February, and we have to send them in. They did let us go backwards because we hadn't been submitted, but they don't want us to do that now. It's a great idea, though. But Renee, he did receive some communication here in the last couple of weeks that indicated that, well, it was spelled out a little differently than what it had been in the past. So we do think that there may be, from our initial review of it, about 300,000 that we may be able to say is unrestricted, but we haven't confirmed that yet. So Renee's going to be working on that, but she's got to, for close to the year, then she's working on this budget amendment and all these new dollars, and then we'll move back to cost-based reimbursement when we don't have so many irons in the fire.
Any other questions on the financials? Hearing none, all those in favor of approving the financials as presented, say aye.
Aye.
All those opposed, motion carried. Next, committee report. For 7A, the Finance Committee, Commissioner Hoffmaster.
So we had our finance committee meeting on October 26th. You have the meeting minutes in front of you. We discussed a couple of the new business items, health insurance and employee contribution part. If you have any questions, we'll certainly answer those for you, but those topics will come up here shortly.
Do I have a motion to approve the Finance Committee meeting minutes as presented?
Support.
Have a motion by Commissioner Lanius, support by Commissioner Hoffmaster. Approve the Finance Committee meeting minutes as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. The Program Policy and Appeals Committee did not meet. So we will proceed on to new business and the elephant in the room. Oh, that could be,
That elephant.
I will tell you, Josh, that we had one of our opioid committee meetings and on the agenda was the elephant in the room. And this is a month or two after you guys had presented. I'm like,
Really?
so the elephant in the room is how we're gonna spend the $2 million that we're getting in Hillsdale County. Is that the elephant in the room or what?
I'm gonna throw out an idea for $10,000 from 3 counties. It's okay. My face doesn't. So, good morning, everyone.
Good morning,
I
Josh.
appreciate you guys giving me the time. I'll do my best to be quick as I love to run my mouth. So my wife reminds me of quite frequently. So you guys will have two pieces of information here, I guess two packets. You will have a formal proposal with a budget that Alex had put together. And then you also have the elephant in the room packet as well. I am going to just go through real quick just to highlight this proposal regarding my reason for being here in the discussion today. Basically, you all are aware that each county has received a good chunk of money regarding the opioid settlement funds. And our agency is wanting to request $10,000 from each respective county, each service county that we serve, of $10,000. So basically what I'm wanting to do and what our division is wanting to do is we developed this elephant in the room opioid use prevention and harm reduction campaign to give an identity to these $10,000 that we're requesting. And just some highlights here on that proposal real quick is you guys will see as you read through that Branch, Hillsdale, and St. Joseph County really are no different than the other counties in the state of Michigan regarding that they are dealing with when it comes to opioid issues, opioid misuse, opioid abuse, and all of that. And it is a very complex situation. It is a very complex issue as well as addiction across the board is. And I guess for me, even to give you guys a little bit of a personal story as well, giving a little bit more background on why the elephant in the room was the title that was chosen is, this is not by any way saying that organizations or anything like that are bypassing something that's obvious in the community. I work very close with people in Branch County. Outside of the health department, I work under numerous scopes as well. We are all aware that this is an issue. The issue that we run into is it's the individuals that are struggling with the opioid abuse, the opioid addiction, that maybe it's perceived as the elephant in the room. Maybe it's something that they're unaware of. Maybe it is something that they're aware of. And what we're wanting to do is to provide them with a sense of information, education, awareness. And my late mother, she was an RN nurse for 25, 30 years. LPN, RN, worked as a nurse across numerous scopes and all that. She had opioid addiction. And this was a woman that was very well knowledged in regards to all of that. Our ministry, where I pastor at on Wednesday nights, we devote that to addiction services as well. And the individuals that walk in to this Wednesday night service don't fit the bill, maybe what many people would assume or think are people that are addicted or addicts, if you will. These are individuals, once again, that hold professional jobs. Like I said, my mom was one of those individuals. So we're really wanting to do what we can to just, once again, give an identity to these dollars, work collaboratively with other organizations, local community mental health, substance abuse task force, to really try to make these dollars stretch. We don't want to try to duplicate any services that are going on right now. We don't want to step on anyone's toes. Once again, we just feel like that there's a strength and a power in working collaboratively, especially with other organizations that really have their proverbial foot in the door with these issues. I have the honor of sitting on both task force in St. Joe County and Branch County, and I see the work that these groups do. I'm very well familiar as well with Pines Behavioral Health here in Branch County. Once again, they are putting forth an effort in regards to trying to combat a very complex issue with opioid abuse in our county. So I'm going to go through though the packet here, just page by page, and kind of give you guys the meat and potatoes of what this campaign is looking at and what we are trying to accomplish with it. Once again, the elephant in the room, this is a focus more on just awareness, education through awareness through education, if you will, for individuals in our respective communities that we serve. So the summary here, once again, the elephant in the room is a proposed opioid use prevention and harm reduction campaign created by the Branch Hillsdale St. Joseph Community Health Agency. As you guys see the second paragraph there, I had the honor to already be able to present this to Hillsdale County and Mr. Leininger. We were able to present to Prevention Works, which is their substance abuse task force that are in Hillsdale County. We're wanting to do the same thing with Branch and with St. Joe County as well. The collaborative campaign will focus on opioid prevention and harm reduction education and awareness through, and these are just numerous platforms and areas that we feel like we could utilize, especially in today's day and age with getting information, education, and awareness out there. You guys look down, there's a point that is pulled out, county-wide community event, which I will explain later on. In this packet, we kind of once again feel like that's it could be a possible sustainability route that we go with this, because as we're saying, we're requesting these dollars as a one-time. We want to look down the road. We don't want this to be just a one-year thing or a one-time thing. once again, we want to get these other organizations involved as well. In-person presentations with students and parents, virtual presentations with students and parents. These are big for me, especially as I said, I like to run my mouth. I've had the opportunity to be able to go around to school in the 3 counties, speak about vaping. We have our Lock It Up campaign. I'm amazed at the power of education still today. And this is something to where when you give people that education and that information, it empowers them to make a decision about themselves as well. And this is what we're wanting to do in that preventative measure. And even once again, possibly even a harm reduction measure as well. Providing resources on medication for opioid use disorder, local and national resources on any 12-step facilitation therapy, local national resources on outpatient and inpatient counseling and rehabilitation. And then here on page 4, just giving some information on the Good Samaritan law. This is a law that, once again, I mean, there's some caveats to this and all that. There's individuals that I know that I've encountered at a personal level. I'm familiar with the Good Samaritan law in regards to just one's ability to be able to make a phone call in the case of an overdose. And once again, there are some stipulations with that in regards to, a person that is making that phone call that's possibly on probation or has a prior record. But this basically just provides some anonymity, I guess, and maybe a lack of backlash or circumstances on the individual that's maybe with someone that's overdosed and making a phone call to law enforcement. A lot of people assume or think if they make that phone call, they don't want to make that phone call because they don't want to be held responsible for that person that is overdosed. So it, in a sense, kind of provides them with a sense of protection. But once again, there's other stipulations to that we would definitely work on making sure that we inform people. And then here on page 5, the countywide community event. This was something that came up when we were discussing in Hillsdale County. We want to try to do our best to try to get as many organizations as possible in one area for one county-wide event. And we even threw out there, maybe this is something we could do between the 3 counties for one event as well. Looking at even organizations from a state level and even a national level, getting people to come in to speak on certain issues and things pertaining to opioid abuse, doing even a panel as well, allowing the community, allowing the public to come in and even listen to that, ask questions as well. And this is something that we saw, once again, it's more of a sustainability option as well. I mean, we could do this one year and be done. This is something that we think, if we develop and really feed into those relationships, form some pretty good relationships with other organizations, that this is something down the road that can continue on annually, even without the $10,000 from the opioid money, because maybe organizations would feed into that financially, maybe get donations from the public, whatever. But once again, this is something that I know in speaking to individuals at Preventions Works and their group, this was something that seemed to be pretty exciting to them as well. And they even mentioned too, what about getting all 3 counties involved? So collaboration, that's the name of the game for this. So that's all I got for you guys.
Any questions for Josh on the? I think I heard that you guys will be at Branch County.
I'm not sure
Or
about
you're not
Branch,
sure?
but in St. Joe, I think we're at the December work meeting.
I believe Alex.
Is that the executive board or is it?
I think she asked us to come to the work meeting.
Yeah.
So.
A couple of things, Josh, and for the other commissioners. This was presented and approved by the Tulsa County Board of Commissioners. We did run this idea in the budget and everything up through Amy Dolinky, who is the contact with MAC, Michigan Association of Counties, that's specializing in the opioid settlement funding and helping to advise counties on proper expenditure of it. One thing that she did stress though is that countywide event. If you're gonna spend the money, you've gotta have that countywide event in your county. So that means there's gotta be 3 countywide, there's gotta be an event in Hillsdale, an event in Branch, and an event in St. Joseph County if this goes forward. Cause that, you've gotta be targeting your county residents, and you can't be making them drive to another county for that.
Right.
So.
Thank you guys very much.
Thank you, Todd.
Yes.
All right, item B underneath new business, PA 152, public employer contribution to the medical benefit plan. And Mr. Hoffmaster came from the finance committee, so I'm gonna let you start out if you would.
Well, thank you. I appreciate that. I'll pass that to Ms. Teresa.
Yeah, so, we're all familiar with PA 152, which indicates that a public, employer cannot spend more than a certain percentage. They can't pay 100% of their medical benefits. There's these rules and all of this stuff that go into that. We have traditionally, prior to last year, always done 80-20. We moved to the hard cap last year, and we set the hard cap at 80% of the cost of the base plan. So we generally offer, we did in the past offer 2 plans. Last year we offered 4 plans for health insurance because we added some lower cost HSA plans. The base plan was set at the traditional base plan. So we did 80% of the cost of the base plan. So if people wanted a better coverage, they could buy up and they would pay the difference. If they wanted less coverage, then they just wouldn't pay so much out of pocket.
For the premium.
Yes, for the premium. Good, thank you.
They may not have as much out of pocket or out of pocket max either, if they, depending on the plan that they choose.
So when doing the math this year, I did run into a little bit of a problem. The PA 152 hard cap went up 4.1%, but insurance rates went up 7.5% for us. So I did run into a little problem at setting the hard cap or at 80% of the cost for the base plan here. But the PA 152 does not require dental and vision. It doesn't cover that. So to get around that, what we have done is we are recommending the hard cap be set at 80% of the cost of the base plan minus dental and vision. And then we will also, the agency will also pay 80% of the cost of the dental and vision plan. That keeps us below the total hard cap and still gives us flexibility to offer lower cost options to our employees. And we think is the best option.
All right, do we have a motion to approve the hard cap contribution as presented?
So moved.
We have a motion by Commissioner Hoffmaster, support by Commissioner Lanius to approve the PA 152 hard cap contribution as presented. Do we have any further discussion? Commissioner Matt?
Only question is, before that, Mr. Chairman, thank you, Teresa, for the good work on this. My concern is, what's the consensus among the staff you have met with about the insurance? Have you checked with the departmental heads and senior employees?
No, we did not take this to the staff. We have traditionally not taken it to the staff. When we get into the actual medical plans themselves, then we do have some feedback from the staff there, but not on what the agency's portion would be.
The reason I said, Mr. Chairman, is we want to keep our employees, and one of the items are health and welfare in a good atmosphere, not only just the dollar salary this way. Thank you, Mr. Chair.
Yeah.
Which is why we want to, again, this year, although we aren't quite there yet, offer the 4 opportunities for staff to select from. And then they can make choices about what works best for their family.
Just one thing, Teresa mentioned that, if you go with the hard cap, or PA 152 says you can't pay all of the employees' health premium. Well, technically you can with the hard cap, if you have a plan that is cheaper than a hard cap figure. And we have a plan that the employees, currently and next year, they plug that plan, it costs them nothing out of their paycheck. for the medical plan itself. So, you know, I have long advocated the easiest way to give somebody a pay raise is to take less out of what you're already paying.
And we did have quite a few people that moved to those lower cost plans.
Any further discussion on the 152, PA 152 funding as presented? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Item C, employer sponsored health insurance, on page 152 of our packet. We'll go to Teresa first and then,
So here again, our renewal was held up because of a technical error by the Blue Cross folks. So our renewal did come late. When we presented this to the finance committee, it was, I had received the information the very day before. There was an error in the spreadsheet that you see on page 62, which I have since corrected. And the error, well, actually, there were two errors on. The error was in the amount in the first column for the current year. When you get down to the option 4 in the dental and vision, there was an error there. For what we're currently paying, it did not include the error was not in the new rates, but there was an error in the new rates. In the there's two different columns, the center column and the right hand column there, or box. That's the two options that we floated to the finance committee. The option in the center would be to keep the current plans that we have. This would be a 7.5% increase in rate, and then change the dental from the current Blue Cross Blue Shield dental that we have to a comparable Delta dental plan. And this speaks to a little bit of what Commissioner Matthew was asking. Our staff were unhappy because of the Blue Cross dental was not being accepted any longer by many of the dentists in the area. We had our administrative clerk call dentists in the area to find out what they were accepting. And because the staff in St. Joe County were really finding it very difficult to get dental care with Blue Cross insurance. In Hillsdale County, it's widely taken, the Blue Cross. In Branch County, it's about half and half. So it is not consistently not taken everywhere, but there were dentists in all 3 counties that did not take it. So we are recommending that we move to a Delta dental. So the middle column would be comparable Delta dental, but our dental plan has not been reviewed in a long time, and it isn't a very good plan, in my opinion. It does not cover preventative at 100%, and it had a max of $800 per year. So we asked for an enhanced dental opt-in, which would cover preventative at 100%, level 1s at 80%, and then level 2 services at 50%, with $1,000 max instead of the $800. So what you see in column 3 there would be the enhanced dental plan through Delta Dental. And the other error that was on this spreadsheet when I took it to finance was the total that would increase if you switched from the comparable dental to the enhanced. And the finance committee reviewed it. I thought it was 14,000, but I had not included the vision in there because we were staying with the same vision. So it will increase the cost by $20,000. So that was the errors in that plan. When we took this to the finance committee, we did not have quotes back from any other carriers other than Blue Cross and then the dental and vision that we were speaking of. I have since received information back from our insurance carrier. They did get quotes from United Healthcare and Priority, and they are both significantly higher. One of them was like 58% higher, and the other one was like 8%, I think. Maybe it was 7 or 8% higher. But it was both more expensive than the Blue Cross plans that we currently have. So my recommendation is still that we continue on with the current plans, the 4 plans that we offer, a buy-up option for those that want additional. The traditional 1,500 plan that we have been, and then 2 lower cost HSA plans, and then changing the dental. I would recommend that we change to the enhanced dental coverage and keep the vision that we currently have. And I would be happy to answer any questions that you
That enhanced dental plan is gonna be a 60% increase. Seen that right?
have.
If I'm looking at page 62, the switch to the 180/50 is 59.3% increase over current.
I'm not sure where you're, oh, yes, sorry. Yeah, that is the. We did ask the agent if they would allow us to offer the lower cost dental as the standard and do the, the 80% and then offer a buy-up option, and they said that was not an option, we can only have one.
I just was gonna forget the contributory, non-contributory. If you want non-contributory, there would be some other plans available. Because the $1,000, 800,000, they're peanuts when it comes to dental exposures. This was reviewed by the finance committee. What's the finance committee's recommendation?
Ours was the enhanced, I believe, wasn't it?
Yeah, the finance committee did recommend that they move forward with the enhanced, but because that dollar figure was different, I felt like it was important to have this discussion again.
And it was, what was the difference in 20,000 as opposed to?
It was, when I reported it to finance, it was in the neighborhood of 15,000, and it is actually 20,000.
20,000. And I personally am, you know the employees better than we do, and if you think that this is a plan that I would agree. I have Delta through the bank, so I know in St. Joseph County, Delta seems like it's more of a widely accepted insurance carrier.
And the biggest complaint I hear from our employees is that they have to pay for cleanings, right? Because it doesn't have 100% of preventative. So that's the biggest complaint that I hear on the dental. But aside from it's not taken anywhere, is that it doesn't pay for cleaning. What do you mean it doesn't pay for preventative?
Yeah.
It just pays 50% of the money.
Yeah.
So the primary goals for the staff were get out of Blue Cross, done. And, make it so that we can get a cleaning without having to pay a lot.
Do we have a motion to approve the medical plan, the Delta Dental option 4 is outlined on page 64, and the group long-term life. Vision and vision plans are presented. So moved. Motion by Commissioner Hoffman, support by Commissioner House to approve the medical plan, dental, vision, group life and accidental death and disability plans that presented, and short-term disability. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Item D, strategic plan update.
You gonna handle this one, Chris?
Oh, I can, absolutely. So this is, I'm really excited. I get kind of geeked out about this. I love this software that we are now using, this VMSB software. It makes it so much easier to bring you reports on a strategic plan. But more importantly, it keeps the strategic plan there where people are looking at it and we're following it. It's not a plan that's sitting on a shelf. We are updating this plan. It has got constant view to people, And I'm really excited that we have this availability of this software to help us make this plan complete, and it's not be just something that we created and then don't follow through with. That being said, there are a number of things here that you will see are completed. So if you look through this, I'm not going to go through every single one of these with you because you all can read. But there's traffic lights indicated here. If it's green, it means we're on track, everything's good. If it is a gold bar, that means that item is completed. We're done with it, moving on to the next thing. If it's yellow, that means it's lagging behind, it needs a little extra attention. If it's red, it's like, whoa, what the heck is going on? Why isn't this moving ahead like it should? It gets kicked to quality improvement, and we work through, okay, what's gone wrong with this? How can we fix it? What do we need to do to move this forward and get back on track? So as you look through this plan, you will see a lot of green. You will see a few things that are red. We are, like I said, actively monitoring these and creating plans. When it goes to red, we're like, whoa, wait a minute. And so I am really excited because there's a lot of good stuff in the strategic plan, and to see it actually moving forward and going through the process and being monitored on a level that we haven't been able to do easily here. It just makes me very excited. Be happy to answer it.
You're excited.
Yeah, me too.
All right, any other comments on the strategic plan update that was presented? Okay, our agenda has no other additional new business. Before we get to the public comment and our adjournment, I noticed our next Board of Health meeting is December 14th. Our committee meeting, we have a Program Policy and Appeal Committee currently scheduled for next week, Wednesday. And we have a Finance Committee meeting scheduled for the 20th. Should we move those closer to our December board meeting? In case,
Yeah. I'm excited again.
as we talk, if we're looking at, ways to maybe enhance the compensation package, would that be better?
Well, we are waiting. One of the things on the strategic plan indicated that the data we were looking for other local health departments to use as a comparison is not complete, and it actually may not be. We may not have that information in time for December, when we hope to take a proposal for increase in wages.
Yeah, so we don't have the mouth data. We do have the data from the other health department survey that was done in, I think, March, that we got the data in May, that I sent out to y'all a couple weeks ago. So we do have some comparison data. We don't have as much as I'd hoped to have, but we will have something.
So, again,
So finance usually meets on Mondays
right.
in the
so,
morning, about the 4th.
Was the 4th too soon, or could you, I don't know, you guys, the 11th? Teresa, I know you like to have that draft packet out to it before that, but yes.
I mean, anything's better than the 20th. So, I mean, the 4th gives me 2 extra weeks.
I'm good either days, the 4th or the 11th.
I'm good right
I'll fit.
Yeah.
Okay.
Teresa, does one work better than the other? 4th, you think?
For me, definitely needs to be the 4th, but
I think the 4th, I'm looking to see if the conference, if this room is available that day.
getting there.
I'm trying to remember how
Are
to
we
get
doing
there.
it at 9? Are we doing it early again?
I'm almost.
You guys want to do it at 9? Thank you.
Okay. So
Maybe
yeah,
the-
works for
Maybe the
me.
finance committee can meet in St. Joseph.
Yeah, wouldn't that be nice? Come see me.
Commissioner Hoffmaster, what about
I am the chair, right?
how does the 6th, or Commissioner Matthew, how does December 6th work for you in the morning?
Check, please. Actually,
Except for something about test stuff. In the afternoon.
it works for me, anytime after 4:30 in the morning till 11.
4:30 in the morning?
Yes.
Okay.
4 out of the question.
That's December sixth.
Yes.
Yeah,
December
Wednesday,
6th.
December sixth,
What time for that one?
4:30.
or 8:30.
Not 4:30. Just, and
About-
then for finance, are we gonna stick with a 9 or 9:30 time?
9 works.
9 o'clock?
So we have the Board of Health, December sixth.
No, we've got, okay, these committee meetings, so,
Okay.
so, yeah.
You need to-
So I will entertain a motion, I'll entertain a motion to move the, upcoming committee meetings to December 4th for the finance and December 6th for the program policy and appeal, from the 20th and the 15th respectively.
Support.
Motion, well, I'll take that from Commissioner Matthew and support from Commissioner Hoffmaster for that. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries.
Motion and change, or was that an addition?
That was
Change.
to change those dates.
Thank you for the clerk.
We are back to any other additional new business?
Fire report and Jared, that touchers.
That's all right. That's all right.
We're supposed to keep that in the what happens in the finance committee meetings, stays in the finance committee.
It looks like it's been beat a little hard. All right, we're back to public comment under item 9. Any additional public comment? All right, motion to adjourn. We have support.
I think I
But motion by Commissioner Laney, support by Commissioner Matthew to adjourn. A reminder, we do have an educational session here once we adjourn, and that's on the other services that are not local essential health services that the agency provides, so please stick around. All those in favor of adjourning, say aye.
Aye.
All those opposed, motion carries. So if you want to take a quick break, get back and we'll have some training.
If you need me to, just let me know.
I should be able to handle anything.
Well,